Hello everyone! Today we're recording a new educational video with Zaryana, the star of our YouTube channel. There's already been another video with her, which has already gained 18.5 million views on the channel. If you haven't watched it, you can go ahead and check that video out. Today we have the second round and we'll thoroughly go through everything and see some new things in this new video that we have today. Zaryana? How are you feeling? Is there anything bothering you right now at the moment?
Well, my neck hurts a bit. At times it's up here and also in the tailbone area occasionally and there.
The sacrum, I presume.
Yeah, that's it.
All right. So now everybody, we're gonna visually diagnose our client, and then after, we'll proceed with the massage and the manual therapy. Looking at the shoulder blades here, the right shoulder blade is clearly higher than the left one in the lower angle of the shoulder blade, in the upper angle. The left shoulder blade is slightly lower and more forward. If we use a ruler, it should look something like this. It should be perfectly straight. As a result, the pelvis shifts to the left and rotation goes to the left side. So it's rotation of the torso, with the right side moving forward to the left, moving up, moving forward with the shoulder blade and the shoulder, while the pelvis goes to the left right here. So we'll be addressing this and we'll be correcting this. And regarding the shoulders, the right shoulder will be higher and the muscles contract and they pull the bone structure upward, as you guys can see right here. The right shoulder will be higher as well, slightly, but it'll also move forward. Because of this, we'll need to use massage to relieve the tension here, and then we'll release muscle spasms and we'll align it. All right, so let's take a look at the muscles right here in her neck. Yeah, there's some tension right here in the front. I can feel it. We need to massage the front neck muscles and the clavicular muscles. That way we can relax them. All right, so line your stomach facing down. And now we're gonna perform the massage. I also wanna mention that I really don't recommend learning tactile techniques from our videos. Tactile techniques are a part of manual therapy, which involves like feeling and assessing the strength of pressure, among other things as well. That's why I conduct seminars and I provide educational videos. Now we'll work with the thoracic region on the right side, the muscular ridge. It's bigger right here, and the ribs are protruding more on the right side than they are on the left side. The task here will be to adjust the articulation of the ribs with her vertebrae right here. I have this towel, but we really don't need the towel because we're gonna be doing this massage with oil. So relax.
Oh my.
Quick and precise movements are made to prevent the muscles from reacting in a bad way. Here, we need to catch the person in a relaxed position, so we use surprise as our main method here. Relax, lie down a little bit. You can use your fingers to adjust, or you can cross your hands to adjust the spine, or even your fists. It depends on the patient and the specific factors, upper and lower thoracic regions, and the task itself, essentially. There's a lot of things to consider here. Just relax a little more. Now turn to the other side. There you go. Give me your shoulder, right here. Relax the shoulder.
Oh, okay.
Shoulders back in place. Alrighty. You can use techniques like this to adjust. So, there's quite a variety of techniques in manual therapy that we use here. I usually choose a series of techniques that I find most suitable and comfortable during the procedure. and they actually are quite often interchangeable. And in principle, it's quite effective in terms of, like we take the effective techniques and apply them. And what's not comfortable for some might be comfortable for others, essentially. So I'll show you exactly which techniques are interchangeable today. That's all right. So let's work on the pelvis, relax. And we take the pelvis, and here we adjust the L5 to S1 vertebrae in the lower ribs here, the connection with the thoracic region. We set it. And then we do the same here on the other side, and we just relax and adjust. Here it's just the rib that's adjusted slightly, along with the vertebral connection. There's some techniques that need to be performed on some patients, but not on others. Let me explain. So, for example, here, this technique right here with the sacroiliac joint is not quite suitable for everybody, but it's suitable for Zaryana. Just like that. There you go. Good. On the sacrum, relax and stretch. Right there. In principle, everything looks good here. There were no joint movements. So let's continue. Now we'll work on your shoulder, and when we adjust it, it's going to involve the clavicle and the shoulder and the first and second ribs here. You can position your arm this way or use a fist. Relax a little bit more. That's Now we're stretching everything. Manual therapy essentially is a leverage impact. That's why we need support and leverage. This is something we haven't done yet.
Cool.
There we go.
Oh, cool.
Now we'll do a cross-body stretch. More. There you go. All right. The shoulders pulled back. And her head is aligned with the massage table here. This is one of the safest adjustments in the cervical region, but it's just one of the projections that we have available here. There. Move your pelvis closer to the edge. Now, the most important thing is when you adjust the spine here, there's a method for adjustment, and it depends on how the patient is positioned. So I'm going to show you another way to position the patient. In this case, you need to position it slightly differently. A bit more like this. There. To adjust these vertebrae, L4 and L5, right here. Relax a bit. Yeah. You can do it at a different angle as well. A different angle like this. A bit closer with the pelvis. Alrighty, so here the torso goes like this. So where the angle is, that's where the adjustment is. Alright, so let's turn the other side.
Whole day is now fun.
So move your pelvis closer. Some people do it at a 30-degree angle, like this here. If you do it like this, you'll just be adjusting the lower thoracic and the lumbar transition. So it goes like this. There. Slightly more of an angle, and you adjust right here. This is the essence and the difference in performing this technique in many different ways. Relax. All right. You can also an analogy to this technique. Lie on your side, facing me. All right, so now this leg, bend it. The same essentially. Same essentially, but these are interchangeable techniques, pretty much. The hip joint, as an option, you can slightly open it towards the edge there. And we also have other ways to mobilize the hip joint, but this method of opening it is probably the most effective, as you guys can see right here. You can also perform mobilization just like this here. Everything looks good here, and there's no blocks. So now, right now, we're gonna work on the bones like this. There. Now we'll adjust the upper thoracic section of this spine right here. And watch this. Lock upwards and towards yourself with pressure on the chest area. Upwards and towards yourself. Yeah, the upper thoracic section is released. And for the lower thoracic, it's the same. And the pressure goes towards the lower part of the chest. Curl forward. Relax, lie facing me. And then right here. And that's it. There's another way to adjust the middle thoracic section, also by stretching. So put your hands behind your head. So lie down. Towards the back. There. Like that. A firm fixation is applied. And we drop the head here in the elbow joint and then raise it. Relax the muscles there. Yes. All right, so look at everything drops. We find the block. Relax the muscles again. And again. Alrighty. There we go. Here, you drop your head to the side. Place it in the armrest. Don't drop it. Relax your muscles. And there's two options for decompression. It can be done with a towel, but the main thing is that the person should be relaxed and their jaw should be closed, okay? So relax.
Wow!
How does that feel?
As if someone just pulled my entire back out. My neck for sure. It's cool, like on each vertebra.
On each vertebrae, yeah? Raise your head up. So let's do a stretch with amplitude movements like this. Relax. Your hand went numb, right?
Oh, wow, my hand. Oh,
yeah, it's numb there, right?
Numb.
All right, it'll pass.
Oh.
And your fingers went numb, right?
Yeah.
It turned red?
Oh, it did. Oh, wow, it's like...
To minimize the stress on your patients, we don't often use the technique of hitting patients. How often it's done in these manual therapy methods? We only use it for the 7th cervical vertebrae. That's the only place that we ever use that kind of technique. Remember that. So first of all, hitting oneself on the fingers is harmful, and it can lead to arthritis and many other joint disorders. So whatever can be done in a less traumatic way, it's better that we do it that way. Much better. All right, now let's relax here. There we go. Alrighty, should look like that. Just shaking up all the joints. Press your chin slightly, please. And for what purpose is this done? Come here. Here's the 7th cervical, the first thoracic. Often they protrude more than necessary, and there's a pinching right here. So you place 2 fingers here, right there, as you can see. Take a deep breath and hold it.
Whoa!
Sit down, please. You feeling it?
Unusual.
Feeling dizzy? Blood rushing to your head right now?
Yeah.
Blood along with oxygen?
A little bit, yeah.
Yeah. It all like saturates your brain, you know? It feels really good. I love when people do it.
I've never been hit during massage.
Well, you got it here today. So how do you feel now? How's everything feeling so far?
Well, it's actually quite easy now and good. My neck was bothering me for a very long time and
Yeah.
my back too.
So let's see what we managed to straighten out today, all right? This shoulder blade is even more even now. Overall, it's visible that... Oh. Hold on a second. Yeah. There, it's straighter now. The muscles around it are pulling it towards the spine, but there's still some areas that we need to work on. Remove some spasms and alleviate the tension. And there should be some areas still left. In general, manual therapy should be done pretty regularly, just like people visit dentists or any other healthcare professional. You got to do it often, and that way the treatment and the therapy will all work. And the regularity of the visits to a manual therapist is absolutely key to the health of your spine. So, thank you guys for coming. Thanks to all of our subscribers here. Today we recorded this video, and subscribe if you haven't already, please. Zaryana, how do you feel today?
Like I was reborn. I can rotate my neck freely now and my back doesn't hurt either.
Take care, everyone.